Hello?
Hello, assalamu alaikum.
Hi, bro. Hi, Tabarak.
Hi, assalamu alaikum.
How's everything?
Everything is good, alhamdulillah. Just getting ready for the discussion, inshallah.
Yeah, inshallah. Hello?
Hello?
Hey.
Assalamu alaikum.
Hey, alaikum salam.
Hi Nadal, how are you?
I'm good. How are you, Tabarak?
Samar.
Oh,
كويسة
yeah.
الحمد لله. Ghaida, how are you?
Good. How are you, Summer? You did sound
I'm
like Tabarak to begin with. So
Really?
yeah, I did think you were Tabarak. I think we're just used to Tabarak just saying Salam Alaikum. to begin with.
Yeah, just jumping on.
Assalamu alaikum, guys.
Alaikum assalam.
Before we get started, let me just check that our SDN word is okay. Great.
Can you guys hear me? Because it's late to hear. I
Okay.
don't know what's wrong.
Oh, there is a lag.
How are you, Summer? You did sound like Tabarak to begin with. So
Really?
yeah, I did oh, that's YouTube. I think we're just used to Tabarak just saying Salam Alaikum.
Yeah, just jumping on.
Assalamu alaikum.
Hello.
Hello, everyone.
Hello. Yes.
Okay.
We hear you.
I'm just going to check that we have Mohammed Garaballa and Nidal Bashir. Are you guys having your cameras? You can turn your cameras on now. I think the rest of us are here now.
Yeah. Okay. Wait.
You guys hear me?
Yep, I can
Hello?
hear you.
Yes.
Can you hear me?
Yes, Nadal, can hear you.
Okay. Great.
Okay, so let's just make sure we have everyone here, and we do. Great. So, assalamu alaikum, everyone. First of all, thank you so much for joining us on this panel. The topic of today's panel is protecting yourself and protecting Sudan during Covid-19. We had a panel last week, which was all about dispelling medical myths around Covid-19. We had we have different panelists now. Some come back, some different ones. So if anybody watching didn't get to watch last week's panel, make sure that you go on our YouTube channel. You can still watch it there. So last week, what we talked about was more about the misinformation. Pardon me, the misinformation spreading rampantly in WhatsApp, in social media about COVID-19, what it is, all the conspiracies around it, all of the myths, all of the anxieties that have come up with all of those myths, how we can, and we touched on a bit of what we can do to protect ourselves. And today we're talking more about what the situation is like in Sudan, how we can look after ourselves physically and mentally, how we can look after the people around us, and anything else that comes up in this conversation. So does that sound good, guys?
Amazing.
Okay, so if we just all go around and introduce ourselves, can you start with yourself, Samar?
My name is Summer, and I am currently based between the UAE and the UK. My background is psychology, specializing in forensic psychology, and I'm in the process now of, I've completed my first step of certification to be a forensic psychologist. On to the second. Yeah.
Great. Thank you so much. And you'll be useful in learning a bit about the mental health toll of this pandemic, the lockdown, and maybe just giving us any suggestion of what we can do to look after ourselves and for those around us. So that'll be really great. Thanks for having you here. And Ghaida, can you tell us a bit about yourself?
Yeah, my name is Laida Mahjoub. I'm a first-year Doctor of Public Health student and also work in the Environmental Protection Agency.
Amazing. Yeah, so this is great. I thought you were so useful last time in bringing the facts when it comes to public health and public health policy. So I'd love to hear more about you, especially when we learn from others about what it's like in Sudan. So Mohammed Garballa, can you tell us a bit about yourself?
You're on mute.
You
Mohammed?
the call.
I'm Mohammed Gariballah. I'm a fourth-year medical student here in Sudan. I'm based here between Sudan and the UK.
Mhm.
And I'm in Phila as a head of external representation.
Mhm. Perfect. So I think it's great that we have people from Sudan to tell us firsthand what it's like, also from a medical background, just telling us from your experiences or what your knowledge is. And also we will talk about Philaha and the work that you're doing to help people stay safely in lockdown, which is great. Nidal?
Actually I turned the video off because I cannot hear you guys.
Oh no.
So I kept an audio. Is that okay?
Yeah, that's okay. We're hearing what we need to hear.
Okay. So should I start or
Just tell us
anyone?
about yourself. Just give us a little introduction about who you are, what your background is before we get into it.
My name is Nada Bashir. I'm based in Saudi Arabia, but currently in Sudan. I'm studying medicine. My final year. That's it.
Perfect. Great. Thank you so much. And we'll also have another person joining us just a bit later than everyone else, Mohammed Mustafa, who's also working for Lahan, also a medical student in Sudan. So I think what's really great is that to get the actual perspective of what things are like in Sudan, those of us outside of Sudan can only speak on what we see, what we hear, but we're not experiencing it. So that's why we really want to hear from you guys. Thank you so much for joining us. Nidal, I can't see you, but I'm hearing you and I know you have so much to contribute today.
Yeah.
So Nidal, you can start. I know you have so much to say.
Yeah, okay. So the Ministry of Health has confirmed 54 new cases, including 5 deaths and 17 recovered. So the total is 1,164 cases, including 64 deaths and 119 recovered. So far now, the COVID-19 has now spread to 17 of Sudan's 18 states. The majority of people with confirmed COVID-19 are living in Khartoum.
Yeah.
So we know that Sudan is in one of the worst situations anywhere in the world to mobilize an effective national response. A collapsed healthcare system hollowed out by 30 years of corrupt rule has also left the country with as many as only 8 ventilators and 200 intensive care hospital beds. Lack to care for the sick for the necessary 14-day quarantines. So yeah, that's actually make the disease so difficult to prevent from spreading here. Yeah. Also, you know, that's poverty, lack of household savings to offset lost income, and lack of access to clear water, proper sanitation, and health supplies.
Yeah.
So yeah, the government is taking social distancing seriously, making every possible effort to limit the kinds of large social gatherings.
Okay.
And yeah, also the Ministry of Health is holding daily press conferences to update the country on best practice for prevention and to highlight the ever-expanding list of government effort to fight the disease. And yeah, there's also a team with the country's mobile phone operators to push out daily reminders of best practice for social distancing. That's it.
So Nidal, what was that? So you were telling us about a scheme with mobile networks.
Yeah.
Yeah. Can you tell us a bit more about that?
So about then, so there is a message that this is a daily reminder of best practice for social distancing, and the Ministry of Health also their daily press conferences.
So Nidal, so far you've touched on a lot of barriers to having the best health. So first of all, guys, just house rules. Everybody feel free to chip in whenever you want. Don't wait for me to ask you to come in. Also, you're also polite. But Nidal brought up a lot of issues right there about how things are so difficult to protect everyone. One of the main things is sanitation, which we all know every time we go to Sudan, that how there are massive discrepancies across, even within the same neighborhood, about plumbing, sanitation, and water cuts. So we can only imagine how much of an impact that is being. What I want to know is, like, how is lockdown going in Khartoum? Like, how is lockdown going? How are people abiding by this when they're being told social distance, no large gatherings? How are people going to the mosque? Are people going praying Tarawih together? Are the streets busy? What are things like? Nidal or Mohammed, feel free to tell us about this.
I went with the family initiative to buy materials for the حقائب Ramadan. ومشينا السوق المحلي, and there's so many people there. It's like ridiculous, and it's scary as well. And there's no regard for coronavirus, the pandemic, none of it. Just no social distances at all. Only, like, I would say 30 to 40% of the people there were wearing masks. Just chatting, really, like, so it was kind of scary.
So when it comes to these rules being enforced, is there any like fines that happen? Like, is there any, how are they being enforced? Are police checking up on people to make sure that people are sticking by the rules or anything like that?
Actually, in the prevention phase of this pandemic, the coordination has seemingly gone well, with military forces acting to close borders and limit public gatherings to enforce social distancing.
Okay, but if it's going well, how are people still all out there in the souk and everything? I'm just kidding.
There is a time actually from 9 in the morning till 1 p.m. You can get all the stuff you need, but after that you have to stay at home.
Oh, okay. So Reda, like, when we're learning about, or we're seeing how other countries have responded to this pandemic, I can talk about, like, UK. I can see how lockdown, maybe how late lockdown started and how we did it. Do we see, like, a difference in the outcomes of how people are putting in effect lockdown and other social distancing measures?
Yeah, so it does vary by country, but generally there is an agreement that lockdowns are effective, and then keeping people apart from each other will prevent the spread of the disease. It does vary state by state here in the US, so some are more strict than others, and some are just even reopening back again. So reopening a few places here and there where people are able to go out, which is alarming because it will increase the disease cases when people are out and about again. That's just the status of what's happening here. But I did have a question for Nadal, or anybody, Hamid as well from Sudan. So before, there was like state borders, like there were closing of state borders, but how has it like spread to so many states all of a sudden? Like, can you give some insight on like how did it spread from Khartoum to all the other states?
Yeah, so when the government said that there is a lockdown, so people in Khartoum, that's people, and they don't have people here in Khartoum, so they went to their village. I think this is the way that how it spread to other states in Sudan. So people travel to village and to Gadarif, Jazeera, and all these states. I think they take the virus with them.
Yeah. I think, you know, regardless though, alhamdulillah, it seems like from the figures Nidal gave us, and also I've seen like a breakdown of which states are affected most. So it's, I think as of yesterday, it was 976 of the cases were in Khartoum. And I think it's about 40 in Al Jazeera, 31 in Al Qadarif. And then the numbers go down, down, down amongst the states. So in some of the states, there's only 1 or 2 cases. So it does seem like, I don't know that exact figure, but it's like over 95% of the cases are in Khartoum. So to me, that seemed like they did very well in preventing cases getting outside of Khartoum quite early, especially when you see like in UK, for a very long time, we were free to travel between cities. Even now, there's not a strict rule that you're not allowed to go between cities. So I think from that point of view, Sudan, from what I saw, Sudan very early on recognized the limitations in its healthcare system and that it needed to act early. But now is a case of how people are actually abiding by those rules. So
actually, it's illegal transfer here in Sudan. Like people travel to, until now, people, if you have a tasrih, you can get it. It's the easiest way you can have it in Sudan. It's tasrih, and that's illegal to just walk around during this crisis, and everyone being selfish. Everyone want to travel and do their things and don't care about if this thing is wrong. So there's illegal transfers here.
But is it all selfish? So Mohammed, you were telling us a bit about your work with Family Initiative. Because I recognize how difficult lockdown would be for a lot of people. So before we go into it, before I go into what I was saying much further, is what is it like for what are the rules regarding going to work, first of all?
You mean work in general?
Yeah, work in general for like any type of field.
The public sector, most of it they have a vacation. We started yesterday after 3 weeks.
Okay.
Lockdown, but the private sector is still working, which is they go back home just before the time.
Oh, okay. So they work up until 1 o'clock and then they go home. Okay. Yeah. And with the public sector, are they still getting paid during this vacation? Do you know?
No.
I'm not sure.
They're not, Nadal. Okay. So this is something I just wanted to establish. For a lot of people, I can recognize the difficulties in not having a regular income for even a week, and the impacts that they will have. We know that there's massive wealth disparities in Sudan as well as other places, but it's markedly so in Sudan. So I think I recognize how difficult it would be for a lot of people not to have a stable income for a week, 2 weeks, 3 weeks, and how much that will impact being able to safely stay in lockdown. But I know that there are communities doing stuff to help people about this. I know with the Family Initiative, do you mind just telling us a little bit about that, Mohammed, about what you're doing through that to help facilitate people to safely stay in lockdown?
Family Initiative, we started it basically like with the whole COVID-19 when it first started showing up. Help people, because we know how like the wealth is so poorly distributed in Sudan. There's so many poor people that could not abide by the lockdown because they living like Sitat Shai, Ghassalin, people that work in these markets. So you're like, okay, so what we can do is provide for them. That means so we give them all the essentials so they can stay home, and then we also what do you call it? Raise awareness on COVID-19, tell them about it, and why it's so dangerous, why you have to see. Basically, that's how it started. We had BHO at first as collaboration, started with BHOs first, and then we got a few other organizations like Medicine Sudan.
Mm-hmm. So Mohammed,
Shab.
yeah?
Yeah.
Yeah, so continue.
Can you hear me?
Yeah, I can hear you. Perfect, thanks.
Where did I leave? Where did I leave off?
No, you were telling us
Because I think the
about
connection got
Medicine
bad.
Sudan, about the different organizations that you've been working with.
Yeah, Medicine Sudan, we had this standing committee on research exchange, public
Mm-hmm.
health, and mental health, all three of the standing committees from Medicine Sudan.
Okay.
And now we're collaborating or supporting actually another campaign called Qadah Shab. And through them, we're supporting them, and we're distributing Haqaib Ramadan and also raising awareness just to help people stay at home, basically.
Yeah. And I think that kind of works like it's really amazing because it's we can't force people to be doing something which they see as more unsafe for them. So I'm really glad there's organizations such as Filaha and all of the collaborations that you guys have that are trying to facilitate that for other people. Anything do you guys want to like add to that, Reda, Summer?
I'm just curious, sorry, Reda. I'm curious, like, to ask Mohammed, when you did, visit these families and were distributing these haqaib, did you find that the people like were aware of COVID and like, when I say aware, I mean like, are they taking the necessary precautions? Or do they acknowledge, what they're supposed to do? Are they abiding by it? Like, what was the reaction that you were seeing?
From the field team,
Yeah.
when I'm sort of like have these is like people know the risks of like COVID-19. They know what's happening, but most of the time it's like I can't really abide by the rules. I have to go out. I don't really have the means to stay at home. But after we talk to them and give the reception of what information about COVID-19 or what to do, wear a mask, the distance, they like they accept it. In Qadah Shab right now, the organization we're working with, we go and check up on them, see how it's going and everything. And people are really taking, like after what we do, after what we give them and like the information we share with them, and just like raising awareness. There is most of the people do stay home. If they have to go out, they try to keep their social distance. So that's basically in like basically. But most
That's
of the time,
amazing.
some people, honestly, in the beginning of family history, didn't even know about COVID-19. Than us. Probably it was just like, okay, it's a virus. It's from China. That's basically it. That's all they knew.
Yeah.
Super interesting. But that's good to hear. Like, it is good to hear that people are, being responsive to it. And like, jazakumullah khair, ufi mizan hasanatkum, inshallah, the work that you're doing. And like, allowing, going out of your way, putting yourself at risk to kind of, educate and inshallah saving other people's lives. That's really good.
For sure. And Reda, were you going to say something as well?
I think I forgot what I was going to say.
Oh, sorry, Reda.
I'm sure you remember. Jump in later. So last week, so what you were saying, you brought up some thoughts that people had, and those were some stuff that we talked about last week. At first, a lot of people didn't believe that COVID was a real thing, that it wasn't going to affect us all. But have you struggled, when you go and talk to people about breaking down some misconceptions as well in Sudan, Mohammed or Nidal?
COF team, so that's the Standing Committee on the Public Health. Their work in the family initiative when they were here was to like break down the myths, you know, the misconceptions occur. And it was like not all of the people who accepted it, and not all, like, because there's this, I would say, Sudanese mentality where everyone's like, oh no, okay, like, نحن عندنا في ناس بيقول لك والله الوضوء بيزح, or like it's been helping us for so long we can use it.
What was that? That's been helping us for so long?
Natural remedies.
Yeah.
It's like, oh, we've been using it for so long. COVID-19 isn't serious. We have work disease, malaria and stuff. So that's some of the stuff you hear when you're on the field. Even inside houses, I would say, not just on the field, like in families and stuff.
Yeah.
What's on?
Abroad, I think you're frozen.
Anything? I can't hear you.
Yeah, I think she's frozen.
Yeah, I'm sorry, I'm back. So I was just saying, what are your guys' thoughts on natural remedies? Rida, Summer, like, what do you guys think of that? Like, how would you respond to that?
Go ahead, Rida. I answered last time.
So I think like some of these remedies, like they do have positive like effects, but I don't think they're the sole thing that you can rely on. So like some of them, like for example, like just take a classic one that everyone knows, like orange is vitamin C. Like it's gonna help you, but it's not gonna cure you. You know, so it can like help you a little bit, but we don't know the extent of how much it can help you, and it definitely is not going to be 100% like a cure for anything or preventing the disease. So it's kind of like an assist, but not enough.
Yeah, I mean, I feel mostly the same as you, Reda, and I feel like there's so much stuff. Like, I don't dismiss a lot of natural medicine because I think there's so much stuff that we don't know about. There's so much like hikmah and everything in the world. But it's, and we touched on this last time, like we just need to make sure that if people have the right information about something, that they don't mislead themselves and others, and you know, create a dangerous situation from blindly following something and not taking the proper precautions. So as you say, vitamin C is a perfect example. We know vitamin C is good for your immune system. Building up your immunity is always going to be good. Getting more vitamin D, more vitamin C, getting more sleep, drinking plenty, honey, ginger, karkade, these are all great things. And you know, if you become unwell, from my point of view, that might make you feel better. Like, for a cold, honey and lemon is good. It might make you feel better, but it's not going to cure you. It might not do anything at all, and it's not going to make that illness get better quicker. So I think that's the main thing that we need to just kind of make people aware of. Do these things because they'll make you feel better, but they're not going to do anything to the illness itself. And you touched on that thing about wudu, like, you know, Muslims wash our bodies 5 times a day, and it's just that whole thing about making sure people are encouraged to wash their hands with soap and water or hand sanitizer. I know of through the Sudan Safe Initiative, which SDN are supporting as well, there is the whole hand sanitizer scheme. So University of Khartoum chemistry department creating hand sanitizers, distributing that to people, educating them on COVID-19. So stuff like that, mashallah, there's so much good work going on in Sudan. And it's just everyone doing their part of spreading the word, spreading the right information, making sure they were all safe. So that's all great.
Yeah, and I think about the wudu thing, it just shows that, you know, I mean, I actually like that sometimes, like I find that sometimes my dad would say that, like, istighfar or salah, like that you're good, you know. It just shows that there's, like, you know, we can only take precautions to a certain extent, right? So if you look at the spiritual aspect, you know, our parents and, you know, the older generation, mashallah, they have so much iman and trust in Allah and trust in that and like dua and stuff. And if you look at it from a spiritual aspect, which they, you know, take predominantly, like no matter what you do at the end of the day, your life is in the hands of God. Whether you're vulnerable and you're, above 80 and you have health conditions, you still can get the virus and be okay. You're like, it's in God's hands at the end of the day. I think it's good to an extent. Like, it's good to have that iman to an extent and just have faith, and that will, like, in turn, like, just reduce your stress and anxiety of it. Like, for me, for sure, like, when I just think of, like, no matter what, it does give me a sense of peace. But obviously, we do have to, like, take both, take the precautions and have our iman.
For sure, it's like tie your camel and trust in Allah. We have to take our precautions and have tawakkul. It just doesn't go on its own. You don't blindly have tawakkul in Allah if you don't actually put in action with yourself. So no, I love that, Samar. That's so true. We should always remember that. Thank you for reminding us of that.
I'm finding it kind of a little bit ironic that so for COVID, like we're kind of like, the majority of it is like kind of like disbelief and a little bit of like natural remedies, but like we don't do that, like especially in the context in Sudan. Like, think in Sudan, they don't do that for other diseases like malaria or typhoid or like diabetes, heart disease. Like for those kind of illnesses, like people know their illnesses and they seek the cure, they seek medical attention for it. But since COVID is new and kind of unknown, it's kind of like kind of more of a comfort kind of thing than like an actual, like, because we just don't know the medical cures for it. So it's kind of like it's kind of an interesting disparity between how you treat other diseases and how to focus on. I think from my perspective, I'm seeing a lot of people for other diseases, they go to like pharmacists, they get a lot of drugs, get a lot of medications. So interesting, it's kind of like different between how they are I guess seeking medical attention for each of the diseases, like new versus old. I'm gonna hit upon a few points. I'm gonna go on a tangent if you guys don't mind.
Go ahead. No, but I think that point, first of all, was so interesting. You're so right. And I think that is a lot to do with like lack of a treatment. If we knew there was a cure, everyone would be obviously lining up for it. But that is so interesting. So go ahead, Reda.
Yeah, so there's a there is a new drug that came out, but it's not a cure. It's called remdesivir. So it's basically it helps shorten the time that people recover. So that's now like the gold standard for care. So like that's a drug that they give people just to reduce their time that they are sick, kind of thing. So we're not sure yet if it's a cure or not. There needs to be a whole bunch of research and stuff on it first. But yeah, so back to the other diseases. So one of our relatives, like a distant relative, passed away today because they had a different disease. It was like, I think they had malaria or something. So they were going from hospital to hospital and they were denied at each hospital because they were basically like not taking non-COVID patients, right? So like the system so overrun that they were like basically traveling from hospital to hospital, and she passed away like mid, I guess, on the road, unfortunately. And so I think like we need to talk about the hospital system in Sudan, and we need to talk about how the different hospitals, like you can't just go into the hospital and get your care. It's like you go here, maybe they have what you need, maybe they don't, maybe they have space, maybe they don't, and then like, or you go somewhere else. And then if you don't have the ability to pay up front, then like you're rejected as well. And then there's also the situation of visitors. So I think you can't just look at a patient, you have to look at the patient and all the visitors are going to come in. So like in terms of like hospital space and like just a connotation around like taking in a patient, it's completely different. And it's like, you have to consider all of these like different factors as well. So like revamping the entire hospital system, like patient intake is like one issue that we need to look at for sure. And then another thing is like accountability. So accountability in all different fields. So like government, which we know that has had a long history. Government accountability like in the hospital systems, and accountability within the different organizations assisting as well. So I heard, I was talking to a friend earlier today, and she was saying like how there was a lady who was speaking to her, she's volunteering at the Federal Ministry of Health. And so another aspect of it is like, we have these young people who are so talented and so like willing and eager to help, that we need to help them develop professionally. And so even though they're serving as volunteers, like they do deserve to like be paid and such like that. So anyway, so she's doing a lot of good work. So they're helping with like a lot of different aspects of the COVID response. And one of them is helping secure PPEs and distributing those PPEs to like the doctors, because there were some protests where doctors were not willing to work because they didn't have PPEs. So they're just kind of just throwing them into the hospitals without any protection. So they're able to provide that. And then there was also like, there was like these free transportations for the doctors. So they were able to transport them wherever they needed. But there was some sort of accountability issue there where some of the drivers, they would fill up their gas for free. So there's certain gas stations dedicated to these these transporters. So the gas was served for free. So anybody here, if they heard the story, correct me, but this is what I've heard from speaking with her. So that basically they provided the gas for free, but then the drivers, they would go and flush out the gas and sell it in the black market and then come back for another refill. So crazy stories like that, where it's just like when you don't have this sort of accountability, people are not going to trust anything anymore. And so like everything kind of falls apart. They're not going to trust information, they're not going to trust assistance. They just like everything kind of, like, they're not even going to trust donating to anything really. So it's just accountability is definitely needed in order for things to even operate correctly.
Yeah.
So maybe some sort of like operator, something would be pretty cool. Auditors, not operators. And then the other point I had was like, there really is kind of a need for a stockpile, like maybe like an assessment of like what's available. Like, there were some pretty cool like PowerPoints and such, but we do need to kind of like have a big picture image of like, what does a stockpile look like? What is missing? What is needed to not only address COVID, but address all the other diseases as well, because those are not going to stop just because of COVID. Like, people are still going to be sick with other illnesses as well.
Yeah.
So that's really needed. And then there's just like there's just like, for example, taking care of staff when staff are sick, like having a replacement in the workforce, and then dealing with like high burnout, which I think Summer is going to touch upon later with like psychology aspect of COVID and such. And then just having coordination between the different agencies, between governments as well, because we've seen some cases where they give out like, oh, these are the curfew hours, but then they changed it all of a sudden, and then they're like, wait, what's happening? And like nobody really knows sometimes what's happening. But it's kind of like having an effective means to disseminate the information to the public would be pretty awesome as well. And we know for sure that there's going to be a huge economic impact of the COVID crisis in Sudan. So it's going to be not just a health issue, but it's also going to be an economic and a social impact issue. There was a pretty cool webinar just recently, the president of Liberia, she was talking about the Ebola crisis and how Liberia still has not recovered up to this date from the 2014 Ebola crisis there. So just taking into account that just having that lack of cushion space or emergency fund to absorb the economic impact is going to be something that we need to take into account as well with the whole COVID crisis. But there are things that could be done. So for example, right now, one suggestion, like one recommendation people put out there is if developing countries could just eliminate water and electricity fees, like just provide free water, free electricity, become some sort of fund to just be able to provide those two essentials. And then that kind of lifts the burden of having to work and having to go into out and about and like basically contaminating others with the disease as well.
Is that in do you mean like countries such as Sudan? If government said that,
that's one recommendation I've seen, is just being able to provide a free water and free electricity, like just eliminate water fees and electricity fees.
That would be incredible. But when we already have like electricity and water cuts every day, because of the pressures of the system, not being able to cope, like how is it even going to get to be, how are we even going to get that free?
Yeah, exactly. Maintenance is going to be a huge issue there. It's like you eliminate the fees, you don't even have a fund coming in, then it's going to be we have a risk of not like unclean water, which is not going to be good. And then electricity is just going to, maybe it's not even going to be there anymore. But those are
like you went through a lot of different points, like going I think it's like quite remarkable what you gave us, which is like a top to bottom overview of where a lot of issues are, with suggestions of what we can do to help. So you raised about the point of PPE. I'm glad you've raised that point because we're trying to do something to help with that. But that whole thing about doctors not having enough personal protective equipment, so that is gloves, face masks, whether it is the standard blue and white surgical face mask or the high the FFP3 masks, which we know protect you against very small droplets of COVID-19, as well as like, you know, caps for the head, gowns for the body. There's so much like head to toe protective equipment that healthcare workers, doctors, nurses, anyone else in a hospital needs that they weren't getting. So I heard about those protests as well, because and rightfully so, you would not expect a soldier to go into war without a bulletproof vest, without a jacket. Mohammed, is Nadal still with us as well? Nadal?
Yeah, I'm here.
Yeah. Can you guys tell us about like what the situation has been like for healthcare workers in hospitals in Sudan in terms of them going to work and how they're protected?
Yeah, so doctors here are suffering. There's a lack of medical supplies, and they don't have any options. You cannot just leave. You can't leave the patient die. You have to work, and that makes a lot of doctors high risk to get the virus. So now there's many doctors, I know them, they all confirmed with the COVID-19.
Okay.
And that actually makes there is a less doctors in hospitals, while we need more hands in hospitals. So the government is working to help to offer face masks and gloves and all these things, but they cannot actually. I know Dr. Sumaya Ali, she's one of the heads in the Ministry of Health. So I spoke to her, and she was quiet, and she said she got the COVID-19 positive, and she's one of the responsible in Soba Hospital, and now nobody can control the situation there. So I think this is the only thing Sudan needs right now, medical supplies, because doctors here are scared. They cannot stop working, and they cannot stay home. They don't have options.
And this is the fear, like for doctors like worldwide. In last week we had Dr. Mohammed, who works in Arizona, talking about how he's using the same one surgical mask for the whole day, which I thought was like, that was just ludicrous. But in Sudan, like many people not even having a surgical mask to use. So in regards to
Actually, I didn't hear what you said. Can you say it again?
So there's no emergency in a pandemic. And what that means is if you as a clinician see an emergency going on with a patient, you would rush to help them. But there's no emergency that is more important than your own health. So you're not rushing to help that patient before putting on your personal protective equipment, because you need to look after yourself first. And that's why I completely empathize with any doctor saying, I can't go to work because I'm not protected, I'm scared. So with regards to that, like, so we're working with the Youth for Change and Development charity, as well as United Missions Relief, to get personal protective equipment to hospitals in Sudan. So far, Youth for Change and Development have already distributed PPE to 5 hospitals outside of Khartoum. And that's something that we're continuing to support them with. But I like what Ghaida said about there being a central stockpile, recognizing how much there is and distributing that centrally from the Ministry of Health to places that need it. Because that stuff is available in Sudan, it's a case of the hospitals not having the money to purchase it all, which I find quite shameful. Okay, so also, can you guys touch on, like, you know, in Sudan, what are the treatment, not what's the treatment, but I know what the treatment is, but what can people get? Nidal, you mentioned a few colleagues of yours that have become really unwell.
Yeah.
What can they receive? Are they being treated at home? Are they being treated in the hospitals?
Yeah. There's no enough bed in the hospital to all patients. We already there is a patient in the hospital, so there is a lack of beds and lack of ventilators and everything. So the
Mm.
thing is there now if you have the symptoms and you call them, so they don't have a solution for you. They just say to you, stay home and stay away from your family. That's it. You cannot go to hospital. There's no place.
Yeah.
And the thing is, there's people they don't want to just like if you feel the symptoms, they keep walking around and say no, I'm okay. It's just malaria. That's what people say here. I just feel it's malaria. It's not. I don't have the virus. And you cannot confirm someone that you have to do the test. And we don't have enough tests here in Sudan. They don't do the test except if you have a severe symptom, like you cannot breathe, or you feel like it's a late stage of the disease. But if you just feel you have a fever or cough or just a mild symptom, they just say stay home. And I heard a lot of stories here in Sudan. One girl, she tweeted on Twitter, she's saying her brother was felt the symptoms, and they called Al-Wabaiya to come and check him, and nobody answered. They called a lot. They kept call, but nobody answered. She said, her mom has a diabetes. She's a diabetic patient, and she was worried about her family, and nobody answered the phone. So she just isolated him in a room and kept giving eligibility like drugs and things like that. And she said she's getting better after 2 weeks. So she advised the people to, if you just felt the symptoms, you don't have to go to hospital. There is no bed. There is no treatment there. You just go and so if you can control the disease from home, so do it.
And that's a universal situation, to be honest, Nida. Like in UK, if you're ill, you stay at home. Like, and that's the reality for a lot of places in America as well. Like if you're unwell, you stay at home unless you're so unwell that you feel like you need to go to hospital. And even in hospital, a lot of the times we'll send people home because there's nothing that we can give them other than oxygen. And if you're well enough, if you're well enough that you don't need oxygen, you'll be sent home. That's the situation in UK. And if you're so unwell that you need oxygen or you need anything else, and you will be admitted. So I think it sounds very similar to what the management is like in a lot of places. However, the troubling thing that you've said is about when people get it, they don't isolate themselves at home. They continue going out, going out to other people, which is really troubling. So we've touched a bit about physical health. And the physical health effects. And I guess we know, or just to clarify, just what you should be doing to look after yourself. It is essentially doing your best to stay at home, seeking out help from initiatives such as Family Initiative, other initiatives that are out there. If you do need financial or other assistance to be able to keep your family safe at home in lockdown, washing your hand frequently. If you're becoming unwell, isolating yourself at home, trying to get to a hospital if you need it. So that's just a quick summary. But just to talk about the mental health toll about it, Summer, I'd really appreciate you talking to us a little bit about that, because it's not just becoming unwell, it's also just the pandemic and the lockdown that is affecting everyone.
Yeah, for sure. So basically when this everything started peaking all around the world, it was all about physically stay home, get your medication. It was all about the physical, understandably, because we're just trying to keep everybody well. But as time goes by, we're noticing the mental health impacts it's having on people who are staying at home because of the lockdown, people who originally already have mental health problems, people who are unable to manage their the sessions, the therapy sessions, for example, that they go to. They manage, for example, if you have anxiety, you have OCD, you rely on a certain routine throughout the day. You rely on a certain type of day that you go by to manage your symptoms, manage your behaviors, manage your thoughts. With this lockdown, kind of that whole thing is just, messed up. Like, you can't do any of that anymore. So both people with mental health problems and people who are not struggling are suffering because anxiety rates are increasing. If you have mental health problems, your symptoms are increasing. The anxiety of not being able to leave the house, the stress of, you're feeling threatened, you're feeling vulnerable, not only for yourself, whether for your family, your relatives. It's really difficult. And like, I was talking to actually Abrad the other day, and she was telling me that that you were having like more people come in with attempted suicide. And throughout the next 3 months, we're expected to see our rates of suicide, skyrocket. Obviously, we don't see that immediately. You see that over, over a few months, and it's expected over like the later months of the year, that mental health professionals are going to be way more in demand. And it's just it's difficult because it's not a lot of light is being shed on it, even though us as regular individuals, we're struggling, and we can just imagine, or we can't even imagine how other people who do have serious mental health diseases are struggling. Like, I was reading a research article earlier, and it was a research that was in America, and it compared the rates of the screening of mental health illnesses between 2018 and April of 2020. And they found that in April 2020, people were 8 times more likely to screen for serious mental health disorders. Okay. And that's just crazy. Like, it's insane. And it's so sad also, because it's like, people who are mental health professionals, not all of them can go into work. They can't even go and provide their sessions. People who are, have their sessions regularly are too scared to go in. So it's just so much.
It is. And it's not just a case of like, people that already have a diagnosis. We're saying, because me and someone, we've talked about this, but it's not just, it's loads of people that I'm seeing, because I work in accident and emergency, or the emergency department. So many people that have chest pain or other symptoms of anxiety attacks, getting very worried about the pandemic and the effects it'll have on them and their family. People that don't have any other diagnosis, but they're having panic attacks and going to hospital because they don't know what's going on, and a panic attack feels like you're dying. So if we think about the average person who before this didn't have any mental health problems, and they're getting affected, we can only imagine the effect it's having on people that do have diagnoses already, serious mental health illnesses or history. And the problem is the access to getting the help right now is going to be harder than ever. But also places in Sudan where already the access to mental health treatments and therapies is already hindered. So somebody, you've worked in Sudan previously, like tell us just about what about the mental health sector is like in Sudan.
Oh, wow. So yeah, I worked in Al Ahfad Trauma Center for around 6 months. I also briefly shadowed a little bit in Tijan al-Mahi in hospital in Durman in the psychiatric ward. I've worked in UAE, and it's incomparable. Like, to be honest with you, everything is so much more heightened in Sudan. Even the symptoms that you see, the behaviors, the rates of suicide, attempted suicide, it's so far beyond. And when I questioned, like, why is it like this? Like, why is it that a person who has OCD in UAE is way more manageable, I would want to say, than somebody who has OCD in Sudan. Obviously, everybody's case is different. No OCD is like the other. But when you see a whole population, or all of the cases that you're seeing is so much, so much more heightened, you question it. And it is because of, the financial stresses. It's, the economical stresses, family stressors, just the country, all of the stress that it is in, it increases obviously those symptoms. I can't honestly imagine how it is in Sudan right now, because I know that Al-Ahfad Trauma Center has been temporarily closed, and it was a opportunity for people to, go and get therapy for free, because that's a big thing as well. Like, I can't afford it. How am I gonna, I can hardly afford, putting food on my table. How am I gonna afford therapy to go talk to someone, quote unquote? But yeah, that was like an opportunity for people to go and get it for free. Obviously, that's shut down. I know a lot of places are doing like online therapy, which is, it's also really good. Obviously, it doesn't create the exact same effect, and it would be better, obviously, to be in person, but nothing is perfect right now. So there's online therapy that I know that they're doing. There's apps as well. I've seen one a lot called Talkspace, where you can kind of find a therapist, and
where's that based, the app?
so it's it's international. It's
okay.
It's an international app that's used, like, it's the most popular therapy app. Yeah. So that's accessible to most people who have an iPhone or Android. How else? They're also doing telephone therapy. I'm not sure, to be honest, if this is actually happening right now in Sudan, because when I did see that they had like a Ahfad Trauma Center that had temporarily shut down, they didn't really specify, to be honest. So I don't know. I have no idea in Sudan if they're providing that. I hope they are.
Okay. And I think it's like the barriers really to people getting like effective mental health treatment isn't just, the money, it's also the stigma and the community understanding of mental health problems. So what would you give any tips, like during this time? I think we all have to be a bit more mindful, not just about our own health, but the health of our friends and our family, the people that we live with. Would you give any advice for people to look out for their family, like what they should recognize, what they should be asking them for or about, to make sure that they're well in terms of their emotional and mental well-being?
Do you mean people who have mental health problems?
Yeah,
or
their family, like people that love them or know them, like how they can reach out to them, how they can look after them.
Support. Like, there's only so much you can do right now, being far away from each other. But the little that you can do can be very impactful as well. Just being there, and what I always say, to any of my friends who are struggling, I have peers and friends who do struggle with mental health issues that I've kind of gone on the journey with them, and like whenever they would come back and would kind of like reflect on it and stuff, it would always be like, it's not about what you say, it's just about you being there. So it's about them being able to reach out to you. It's them being comfortable and having that, safe, like feeling like you being kind of like a comfort zone for them, whether you're living with them or not. If it's a family member or not, you just need to not also put too much pressure on them, because this period can be very overwhelming, and there's a lot of pressure to do so many things: stay home, wear a mask, wash your hands, and even though these things for any other person can be mild, for somebody who does have anxiety, for example, it can be really, really stressful. So just what I would recommend for also people who are living with somebody who has a mental health problem is routines are essential. Whether it be you have a mental health problem or not, if you every morning you create a routine together, it doesn't matter if you work, it doesn't matter, it's a mandek موضوع and you have nothing to do that day. It's just about creating a list, or kind of like being able to check that off throughout the day, being able to, you know, go through your day with somebody and feeling a sense of productiveness throughout the day. It doesn't matter if it's just taking a shower, because for some people taking a shower in itself is an accomplishment. So, and also like investing in, you know, something that will bring you like some sense of peace, whether it be, you know, there's this pressure nowadays to be productive, invest in your hobbies, try, do this, do everything. And that pressure in itself can be overwhelming. However, I also do like, if you do find that inside of you, go for it. Like, you have nothing to lose. Find something that makes you feel relaxed, makes you feel, you know, at ease, whether it be just you go for a walk, watching a TV show. Like, it's more about, for somebody who has mental health problems, learning to manage in this new environment, because you're so used to a certain routine that helps you manage your, you know, anxious thoughts, depressive thoughts, you know, your OCD
and
behaviors.
the uncertainty behind this all is going to further exacerbate that lack of routine, because you can't really anticipate what tomorrow is going to be like. And I think, I can see that making things even more you know, acute, people more anxious with that uncertainty. I like what you're saying about keep with the routine when people are at home, you know, keeping with the routine to keep things structured, to kind of bring more certainty to their day. I also think about OCD and how a lot of OCD, obsessive compulsive disorder, is rooted in rituals, and how all of the hand washing we're encouraging people to do can maybe trigger some of those rituals, or that fears about cleanliness, and the environment being dirty, or contaminated, how that may further exacerbate those obsessive compulsive thoughts.
Definitely, like, even just me and, you know, my mom, like, whenever something comes into the house, it's like, don't touch it, no one touch it, no one go near it, like, it's like there's a bomb
like
inside or something.
It's like that scene from Monsters Inc. where they just jump on the monster, or no, the child that comes in.
Exactly. So you can imagine how, if us, just as, you know, regular people who are quote unquote healthy, can be struggling with this. People who do have anxiety, that just, you know, that skyrockets. People who are germaphobes, and it's difficult. There's nothing that I can say that can be like, okay, do 1, 2, 3, 4, and you're good. What I would say, that if you need therapy, go to therapy. If you need in-person therapy, go to therapy. Because just the same way that somebody will go to accident emergency, even in the middle of a pandemic, because they broke their leg, you need to, you know, if you need to, you can go. You know, there are means to, you know, online, but if it's not accessible, it's not accessible. So if you're allowed to go for a walk, if you're allowed to go to the supermarket, you're allowed to take care of your mind, you know?
Yeah, for sure. So we've got a question. Thank you so much for that. Thanks so much for that, Summer. That was like a really good monthly of advice that we can use for ourselves and the people around us. It's definitely advice that I'm going to use on myself and people around me and patients that I see. So thank you so much for being so informative. And I think we should always be remembering, you know, it's not just our physical health, our mental health informs our physical health and vice versa. So we just need to be really mindful of that. We've got one question, and first of all, anybody, please feel free to ask us questions. But this is from Ibrahim, who asked, a question for all. I understand there's probably no direct answer to this, but to get your thoughts, how would you try to advise Sudanese older aunties and uncles to take the social distancing seriously? And this is regarding our uncles and aunties who are so used to always being social and finding it hard to get them to take it seriously and remain socially inactive for the time being. So
this reminds me of, I think, Ghaida, you mentioned this earlier when we were chatting before the call. So with our parents, with aunties and uncles, we have to acknowledge something, that they are feeling so vulnerable right now. You know, if we as, you know, healthy young people are feeling vulnerable, you can imagine how our parents are feeling. You know, they're feeling threatened. Everything on the news is telling them, listen, if you get this virus, you're gonna die. You know, and most of the news that they're receiving is negative news. So they're feeling so threatened. So it's very natural for, you know, people who are feeling threatened, are feeling vulnerable, to just be in denial. You know, at the beginning of this pandemic, I was in denial. You know, I was like, no way this whole world is going to shut down. But it did. And, you know, subhanAllah, everything is in God's hands and it's his will. But they're like, it's understandable to an extent that they are in denial. They don't want to believe that their livelihoods are threatened. They don't want to believe that if they go out to work, they're at risk. And it's not only their fear for themselves, you know, their fear for their parents, their fear for their peers, their friends, everybody they know is around their age, and they're recognizing like, oh damn, I'm vulnerable. And then when it comes to us as like their kids, and we're so scared for them, and like, mama, you have to do this, Bobby, you have to do this, like it's hard for them to accept it, I would say, because for me, like, I get so passionate, you know, especially with my parents, because, you know, I care about them so much. So if they're breaking the social distancing, like, I'm trying to protect you, like, why are you not listening? And just the reality is, like, they won't accept information from somebody that is yelling at them or their tone is not the right tone, or the way. So what you have to try and do is like engage in discussions with them, to ask them questions like, okay, so what do you think we should do about this? How are we going to manage this right now? You know, engage in discussions, don't always feel like you know more, because I know that for us, like, we do have a sense of like, sometimes we feel like we know more, we have to protect them, or we can do this and this and this. So what I read recently was like, try and if you're trying to get if a message, if you're trying to get a message across to them, try and get it across through a trusted source. So if they trust CNN, you know, send them a CNN video that tells them that. If they trust WhatsApp, whatever it is, you know, make sure that the information they're receiving is information from a trusted source, a source that they will listen to. And be patient with them also. This is as much as it's difficult for us, and yes, millennials have more anxiety and depressed, you know, situations and so on all of that, but at the end of the day, they're going through it too. You know, they're feeling even more vulnerable than us. Their mental health is also being affected by all of this.
So trusted source, be gentle with advice, no yelling, and and also, you know, not acting like we know better than our parents, and like recognizing being anxious. Or great 5-point plan you gave us.
And also it's because sorry, but like, I'm not trying to stir the pot here, but women in themselves are, you know, more anxious people. Like, research says that women are more prone to anxiety, just because of how they are in their nature. Men, on the other hand, men are, because of like, they are protectors, you know, this is like who they are in their natures. They're protectors. I have to protect my family. There's a sense of, you know, no, I can go out and do this. I'll go do the shopping. You know, I can still go to work. I'll be fine. I'll maintain distance. You know, it's an ego thing. Like, I'm sorry, guys, but it is an ego thing. And obviously it's not limited to men, but it is also much more prominent in the older generation. You know, that feeling like, I've raised you my whole life and I've done this for you my whole life. I can go and, you know, continue doing that, when you were just like, no, we'll do it. It's difficult for them to accept that they need to be taken care of now. you know, rather than them constantly be taking care of their kids, taking care of everyone. Now they have to be taken care of. Now they have to stay home more than I need to stay home.
Yeah. It is difficult. And I think maybe just acknowledge, like going in, when you're giving advice to somebody, going in from the point of view, like recognizing what their barriers are to doing something, it would be helpful. Reda, do you have any advice? Like if you've been trying to give advice to family members within or without Sudan, like how, if you've experienced this, how have you approached it?
I think Summer covered everything pretty much. Like I think, like you said, it's like you give them a trusted source. You kind of speak at like speak from their perspective, kind of thing. Like what things like do they put as a priority? Like and speak just from their perspective, and then build that connection pretty much. Otherwise, it's just like if you're speaking at this level and then they're speaking at that level, it's just you're not gonna. There's no connection that's gonna be built there.
Yeah. And Mohammed, you talked a bit about this earlier when you were talking about, you know, when you were going out, going to families. And what I gathered from you is that once you actually explain things to people in a lot more detail, it seems like they took your advice a bit more. Is that right?
Yeah. But you can, honestly, with what we do and like how Sudanese people are, you can't really expect much, to be honest. Because I think like if we're talking COVID-19 outside of Sudan, there's so many services that actually like might help you stay home, like delivery and all this kind of different stuff. And the wealth itself, how in Sudan is so poorly distributed. It's actually like harder here in Sudan because we don't have these services. Like we don't have what do you call it? We can't get someone to deliver the vegetables to us, you know, the essentials. الغاز الحاجات دي كلها like you have to leave your house. And it's actually like, so with our work it's just like, okay, so they are responsive to it, but will they abide by it? What is the next situation for them going to be like? Like, is there going to be an emergency? الغاز قطع, الكهرباء قطعت. ما أعرف. And most of these poor people have like situations where يقول مرة ممكن زول يجي يسرق الحاجات اللي احنا ادينا لهم. You know, like something like that might happen. So like in Sudan, it's actually very, very hard to know what might happen next in regards to, okay, so they responded, but what's the next move that's going to happen to them?
Yeah, and I think that's just very worrying, isn't it? The uncertainty of things coming, like to stop your habits because of that uncertainty. Yeah, it's very difficult to even battle that. Thank you, Mohammed. Somebody asked a question, Mutamman Sadiq. So what do you guys think about the funeral dilemma in Sudan? So Mohammed and Nidal, can you shed light on that? What is the funeral dilemma in Sudan? Are you aware of this?
In Sudan, أول حاجة, I think first thing is موضوع these, what do you call it, funerals. Until now, like most of the people that I know have went to a funeral in the last couple of days, which to me is like, I think it's very like, what do you call it? It's not no responsible thing to do. Because it's very risky. Because like in our culture, you have to go to these funerals. You have to attend. You have to go to the person. So
yeah,
it's even the funeral situation itself is kind of like a what if here in Sudan.
It's very difficult, I think. Because things like a wedding, people can postpone that. Lamat, people are going to postpone that. But I think when it comes to funerals, we have an obligation Islamically, you know, to pray for the dead, to pray that Allah has mercy on them, to attend their janazah. I have just an anecdote about this. I have a family member who passed away a few weeks ago, and he told his family the day before, don't do a bika for me, like don't afrusho for me because of the COVID pandemic. And if he never said that, they would have been obliged to invite everyone around to the house for 3 days or however long it is. And I feel like it's quite it's quite sad that somebody has to say that before they die, because they know what the situation is. But by doing that, he just had so much wisdom in saying that to his family, to kind of give them the opportunity to make the wise decision. But regardless, people would still turn up, of course, because there's an obligation in our culture and in our deen to kind of turn up somebody's funeral, turn up and give our condolences to the family, and to make dua for them communally. So I think it's really, really difficult. Regarding funerals, is there, I don't know much about this, unfortunately. It's something for me to look up on. So I'm really glad, like, Muhammad, thank you for bringing up this question, because it's something I want to look up on a bit more. But about how funeral services, this, just because I can imagine all of the logistics of going into it to protect the people that are burying them, that are doing ghusl for them. I think that's something that's been an issue in the UK in facilitating ghusl for Muslims that have passed away. In my hospital, I talked to one of the palliative care leads in my hospital, and they said, for people that die and they're Muslim in my hospital, unfortunately, they've not been able to facilitate the ghusl for Muslims that have died, but they ensure that they get a Muslim burial. And I find that very sad. And I just want to know if there's any such issues in Sudan that you're aware of.
I think the ghusl, they stopped it.
What was that?
What I've heard is that they've stopped it
Mm.
for any COVID-19.
Mm.
Also, the burial in itself, I don't think any family members are allowed to attend, maybe just one or two. And then after that, even like burying them is done by health officials who are wearing, full protective care, protective equipment. And then I think they, we call it, sanitize the area around the grave, and after that, burying them. And then they do the, al-dafn. So that's honestly what I've heard, and like what's been going around like social media, how there's been videos around as well that I've seen.
So it sounds like to me like they are trying to do like a very safe funerals for people. It's just a case of it's just, you know what, this whole situation, what it makes me think of is, if you want to encourage anybody to look after themselves and their family, you need to tell them what dying from COVID-19 is like. And I think that's very sad. And it's a case of nobody being able to attend your funeral and your family members not being able to perform ghusl for you. And I think for me, that really breaks my heart when I think about that. And when I think about people that I've seen in hospital, or when I think about people that have passed away, Muslims and non-Muslims, and I think about how sad and lonely it can be to pass away from COVID-19. And I think exposing people to that horror, I think, is what they need to protect themselves, to prevent that happening to them and their family. Yeah. Does anybody else have any like comments on that? Any thoughts?
Yeah, I had a question about decontamination sites. So not more so for like, I guess the workers, either hospital workers or whatever. So do they like, are they building temporary like decontamination sites where you can kind of like just put all the clothes, all the PPEs and everything in one place and just like get it like decontaminated somehow, so that you're not in the hospital itself? So kind of like a separate, like isolated place for the decontamination, and then being able to like resume regular hospital operations, like a separate like decontamination site? Or how is like decontamination like working?
Is that something you know about, Mohammed or Nadal?
Actually, I don't have any idea about this, but I think they work on to build a place for that things. I read the Minister of Health saying that.
Yeah, I think maybe it's a bit difficult knowing about this if you're not working in hospitals. I mean, I personally wouldn't be able to comment on the decontamination policy in even my hospital, but I think it's important for us to like know about these things because those are the ways that we can keep things safe. But I think I can appreciate why they might not know about that because I don't even know about it in UK. We have just another question on the YouTube live, which was, why do some Sudanese people find it shameful or embarrassing to come forward and admit to having COVID-19 like they would hide it from others? So that's very interesting. Like Nidal, is that something, an experience that you've had or heard about?
Yeah, actually, if someone had a COVID-19 positive, they hide the person. They say, no, الكلام ده ما صح. We don't have someone here who has the COVID. It's a disease. You can't be ashamed of it. So if you have COVID, you have to go to hospital to get treatment. But it's so these people, they still uneducated and that feel like we need more knowledge here to about spread awareness about the COVID, and you don't have to be ashamed of the disease. It's a disease, and you have to deal with it. Hiding it makes make it worse, and may you die from it. So yeah, people here hiding the disease and be ashamed of it.
Yeah, I wonder why. I mean, I can understand maybe one idea of why people may want to hide it from others, which is the ostracification, being ostracized from having it, because everyone would be afraid of being near you, because you really should self-isolate. Yeah.
Because there was a bika recently, someone in my family, and my cousin and her mom went to the bika, right? They found out after the bika, I think I told you this, they found out after the bika that the person that had passed away had COVID-19. So they were obviously, they self-isolated, and they live in, my cousin and her mom, they live in Amara. So they were self-isolating. I think it was past the 2 weeks. They were fine, no symptoms. And they would go downstairs, and then people within the Amar would be like, keep away from us, like, ew, like it's shameful, and like speaking about them in like a not nice way. And I remember my cousin came and talked to me about it. She was like really upset about like why would they, it's not aib. And I'm noticing more and more that people in Sudan are I think because they don't understand it, and because there's not a treatment, they're scared of it. So it's easier to just kind of avoid the situation, and perhaps when somebody does have it in their family and they don't share it to other people, it might not be because it's ebb. It might be because, for example, they don't want visitors to come, and they want to keep that barrier. SubhanAllah, like it could be anything. But yeah, I've definitely heard of that, of it being ebb. But I just feel like when people just don't understand something, they run away from it.
Yeah. So I guess, yeah, it's the fear of people ostracizing you, treating you differently, discrimination from it. And I think it's difficult right now when we actually don't have a lot of information about how long you're contagious for. So in the UK, we're told you isolate for 7 days. So if one person became ill, they stay at home for 7 days. If they're still ill after it, they stay at home and isolate for a bit longer. But I don't know where that comes from, because people are still unwell. Some people are still unwell for weeks afterwards. Some people don't even have the illness. I mean, they don't even have the symptoms, but they have the virus. They're asymptomatic and they are contagious. So it's really difficult at the moment for us to know how long are you truly contagious for. And if we had that, we can say to people like your family members who, okay, I've isolated for 2 weeks, I'm definitely not contagious anymore. And that's the guidance that we have at the moment, but it's not so clear cut to say that. So I think it's going to be this kind of difficult situation for quite a long time. What you were saying, Summer. So we don't have any more questions. We've had a few comments about, doctors striking at the COVID center in Khartoum yesterday due to lack of PPE and disinfectants. I've seen videos spreading on WhatsApp that I've seen of young doctors protesting about this. And also, this is like a worldwide situation. The lack of personal protective equipment is a worldwide dilemma, but also in Sudan, furthermore, we also have a problem with medical equipment in Sudan as well. So before we finish, before we kind of wrap up and I give a summary, I just want to make everyone aware of initiatives that are going on to provide all of this equipment. So there is the Sudan is Safe initiative that we've already touched on with Mohammed, which is partially to do with food packs to provide for families in need, but as well as hand sanitizers and spreading awareness of COVID-19. And there is the Layli Ramadan Emergency Sudan fundraiser, which inshallah, the website will be coming out in the next couple of days, where we are supporting Youth for Change and Development, as well as United Missions Relief, to provide medical equipment, including personal protective equipment for hospitals around Sudan. So I mentioned this earlier, Youth for Change and Development, they've already distributed PPE to 5 hospitals outside of Khartoum. So that's Hasahisa, I can't remember all the hospitals, Kosti, Al-Duwim, Al-Jirish, I can't remember where else. Niala, so those are 5 hospitals, and in the next week, 6 more hospitals. United Missions Relief, we're waiting for them to be transporting donations to Sudan as well. So there's a lot of good work going on. If anybody just hearing everything we've talked about feels like, how can I help? You can help by donating. So look out for the SDN fundraiser on the SDN social media. Thank you so much, everyone, for joining us. A quick summary of everything we talked about. So we talked a lot about what the situation in Sudan is like, in hospitals in Sudan, the lack of equipment, the lack of medical equipment, problems with doctors not being able to attend work because of transport issues, PPE issues, the lack of hospital beds, all of these issues that we've been exposed to from a medical point of view, but also from a social point of view, the issues of social distancing and all of the barriers to that, and misinformation about how you can protect yourself against this disease. And we also touched upon, as well as some of the physical health aspects, the mental health burden of COVID-19, and with some useful advice of what we can do to overcome those burdens. So thank you so much, everyone, for joining us. Before we go, any last remarks, any last words or comments from anyone?
Thank you for being an amazing host.
No. It's okay. Ghaida, Mohammed, Nidal, anything else you guys would like to add?
Yeah, I want to adding to Sudanese economic burden, the national level economic intend to invest broad-based public support for the government's economic reform agenda for fuel, and has been postponed this past week and has not been rescheduled. An international donor conference intended to bring in fresh pledges of international financial support still lack a host, and also appears extended to push it back from its hold for June. So yeah, now going forward, all eyes will be assessing Prime Minister Hamdok ability to reassure a worried public, the skeptical donor community, and unreformed security sector that he can rally a national response to crisis our country faces.
Thank you so much for sharing all of that, Nidal. Thank you very much. Great. So before we go, Happy birthday to Reda, because it was her birthday yesterday.
Ooh, happy birthday, girl.
So just a public happy birthday. Thank you all so much for joining us. It's been a really informative panel discussion this time, as well as those of you that joined us last time. Anybody wants to watch that, it's on the SDN YouTube channel, as well as lots of other great workshops and discussions. If anybody has any other questions after we've ended it, feel free to comment on the YouTube channel, and like any one of us can come and respond to those. So, assalamu alaikum.
Alaikum salam, everyone.
Bye-bye, everyone.
Bye.
Bye-bye. I'm just sticking around until the YouTube catches up.
Yeah, I need to end it also, right? As it catches up, it's like behind a little bit.
Yeah, I can see. I'm waiting for a sec for everyone to be off.
Okay, I think once you're in the last one on the screen, I could probably end it. Dude, you guys did fantastic, mashallah.
Are you sure?